Cool. All right, so I'm live on YouTube. Today I'm going to be talking about lower extremity progressions of exercises. So I'm going to take you through square one. Let me hop on Instagram live first. If there's any questions, feel free to drop it below. I'll check it out. Let me move this screen over. Okay. Yeah, so if there's any questions as I go through this, feel free to drop it on YouTube. I'll check these out as we go through these exercises. Bring in a little bit of light so you can see me a little better. All right, cool. Now I'm also live on Instagram. Let me put this right here. Cool. So I'm going to be talking about lower extremity exercise progressions. There's progressions. If you can hear me, give me a thumbs up. Okay. Let me make this. Pin comment. Cool. All right. So today I'm going to be talking about lower extremity exercise progressions. Thumbs up if you can hear me on Instagram. Same thing on YouTube. So I'm going to start with the way I progress exercises from stage one. This can be for anyone post-operative, anyone with a musculoskeletal injury. So step number one is usually non-weight bearing for me. I'll focus on a lot of gluteal activation, and there's a lot of research suggesting why you should strengthen the glutes. But in general, I'll go into just non-weight bearing exercises. Start with isometrics. My three go-tos are clam holds, sideline hip abduction, and then fire hydrant in a quadruped position. So I'll just do isometric glute activation drills, and then I'll go into isotonic, where I go through a range of motion doing concentric, eccentric with all of those exercises. So that's first step, non-weight bearing. And then once they're able to tolerate a little load, and this is not specific to BFR. You can use BFR with any of these exercises, really, especially with the lower level stuff. So then once they're able to bear weight, I'll get them up and I'll do double leg static exercises. So I'll just have them hold a specific position, whether that's a squat or a deadlift, and then eventually transitioning them into a single leg exercise, such as a lunge. That's not yet single leg yet, but it's a transition to single leg. So I'll get them into a static lunge and then progress into a single limb static exercise. This would be something like a single leg squat hold. I love the Captain Morgans, which is when you put one leg up against the wall and you're holding that to get frontal plane stability as well. Step down holds, step ups, standing fire hydrants. All these things are performed statically still. So just recapping, I went from non-weight bearing to weight bearing, and then weight bearing I went double limb support static, and then single limb support static, and then next what I would do is a double limb support dynamic. So now what I would do with those same double limb exercises, like the squats and the deadlift, I'll have them go through the motion. It's an isotonic exercise now, where they're doing the concentric component and the eccentric component to the exercise. And at this point, I'll start loading them up. I'll have them hold on to a kettlebell or a dumbbell and make it a little bit more difficult so they can start adapting to the stress I'm giving them. And then same idea. Now I'm going to transition that same dynamic exercise from double limb to single limb. So that you can use the same exercises, but now what you're doing is you're loading it up, and also you're going through a range of motion. So with those exercises, like the step down, the step up, what else did I say? Captain Morgan. You can have them go through a motion. That way, it's a little more of a challenge from just an isometric exercise. Also, as I'm going through this, feel free to drop your questions. I'm going to go through my progression, and then I'll start answering some of your questions. It seems like there's already some decent engagement here. Same thing on YouTube as well. Answer as I finish this up, I'll put it all together again, and then answer your guys' questions that you have. So the single limb support dynamic it was the phase that I was at right now. So just recapping again, I went from non-weight bearing to double limb static to single limb static to double limb dynamic, adding a load, to single leg dynamic, adding a load. And then next is double limb ballistic, where I'm actually getting someone to create more of a velocity-based movement where you're creating some power. And so you're moving a little bit quicker with these exercises. We actually came out with an article probably 2.5, 3 weeks ago now regarding exercises that you can perform at home with just a kettlebell or a dumbbell that you can use to create some power. These are things like jump squats, lateral lunges. It's more the way you perform it that will make the exercise power-based or not. It's not the exercise itself. So you want to make sure to create a very strong, powerful contraction. And the same idea here. You want to do a double leg to single leg, where you're doing things like jump squats with a load, and then you can go into jumping lunges, and then you can start progressing into something like a single leg jump. And most of these exercises right now have been just the sagittal plane, but you can do other planes of motions. You can do a bounds from side to side, like a skater lunge. But hops are the best way that you can just target a single leg stability. So basically, from there, now you would go to return to sport stuff, whether it's cutting, landing, turning, having someone go through those motions that they'll need for the higher level exercises. Okay, so I already got a good amount of questions. I'm just going to recap real quick, and then I'll answer your guys' questions. So non-weight bearing, starting isometrics like those clams, sideline hip abduction, fire hydrants, and then you can go to isotonic exercises where you're doing the same things, but you're going through a motion. Now that someone can bear a weight, you go into double leg static holds, then single limb static holds, then double limb dynamic with a load, single limb dynamic with a load, and then you can do double limb ballistic, single limb ballistic, and then return to sport. So that's the progression. I gave you a few exercises throughout each one, but let me know if something doesn't make sense and I'll fill in the gaps there. Okay. How are you? I'm good. How are you doing? Fun 23. And let me know if you guys like that progression. Ideally, I would show you the exercises themselves, but I'm here working out of the house by myself today, so that's not really an option. You are very cool, guys. Thank you, 58453M. Chandra Malaysia Patele. You can this progression works for you. It's all a matter of load management. You want to find where you are in the continuum and see how much you can tolerate in terms of load, and then slowly progress. This is true for almost every injury. Any advice for rib cage, TJ the Tiger? I would see a physical therapist. It's hard for me to specifically give you any recommendations based on off that information. Mohammed Anis 195. Do you think this job will fit someone who's not very social? For physical therapy, I'm assuming you'll learn to be social, but there's a huge component to human interaction and being able to empathize with your patients, and you'll have some good mentors along the way, which you'll pick up on a lot of things. But it is an important trait to have. What day is the app being released? Mal Cook 13. There's a couple different programs we're working on right now, but the low back pain specifically should be released by the end of February. So we'll let you guys know once we have a strict date. It's looking pretty good so far. If you guys haven't already looked into it, there's a link in our bio on Instagram specifically that will give you some more insight in terms of what this low back pain app consists of. What does the pinned do? A puzzle? Well, it's just to show you guys what I'm talking about, so people that join in the chat later on can see the topic of discussion. At what point would you use BFR in the recovery? Struan 23. That's a good question. Really, the earlier phases of that progression that I just talked about is where BFR training will showcase its benefits the best. So when someone's non-weight bearing, especially, that's where you want to utilize it more. When someone's up and able to do these higher level exercises, like these power-based exercises, it's not as necessary at that point. But the lower level someone is, and the more limitation they have to load, the more BFR training will probably be a good way to augment your results that you're looking for in the clinic. You're doing the same things, you're just applying this tourniquet. I'm skipping a lot of the stuff that doesn't have to pertain with what I was discussing about. A lot of you guys are asking very specific questions in terms of your pain. I can't really give you insight in terms of that. I would recommend you seeing a local physiotherapist or physical therapist, depending on where you are. And if you're not sure, there's a website. You can DM us your zip code, and we'll actually shoot me an email, arash@theprehabguys.com. And if you have your zip code, I can refer you to a local physical therapist that I think would be appropriate for you. But specific questions relating to your guys' frozen shoulder, SCM tightness, it's hard for me to specifically say what you need. Best way to activate rotator cuff muscles. It depends which muscle you're looking to target. What is there a specific muscle, Rob Scott 123, that you're looking to target? And I'm gonna wrap it up. I'm trying to keep these within 10 minutes. Actually, I'm a little bit over, but if there's any last minute questions, feel free to drop it below. With rotator cuff muscles, I like to do shoulder ER at the side, shoulder ER at 90. I'll do a lot of low level. Supraspinatus is highly active in the lower levels of shoulder abduction. I'll do some isometric holds here. And the strongest muscle is actually the subscap. So I'll do a lot of shoulder IR, especially at that 90-degree position. So that'll address each of those 4 rotator cuff muscles. Cool. All right, guys, I'm gonna sign off. I'll put this on the Instagram TV. I'm not sure if anyone checks that out, but I'm gonna leave it up on there for anyone to look at in the future. Cool. Thanks for tuning in.